Hey, it's Taylor with Mom on the Spectrum, and today we have a more sensitive subject. We are going to be talking about the prevalence of eating disorders and autism. This is a topic that has been requested since I started my channel 2 years ago, and we're finally sitting down to talk about this. Obviously, trigger warning, we're going to be deep diving into 4 different types of eating disorders. If that's a sensitive issue for you, please feel free to save this to your watch later list and come back later. If you are going to watch, make sure please that you're in a well-regulated state and that this is information that you can handle right now. If at any point during the video, if you start to feel overwhelmed or uncomfortable, just pause, come back. There's no need to push through a video. I know sometimes if I find a topic that seems particularly interesting to me, I want to watch it, I want to finish it right now, but please, it's just going to lead to more dysregulation if you watch when you're not in the right mindset. So please be mindful of your own needs here today. I'm not a medical professional, I'm not a therapist, so please make sure if you're going to incorporate any information or resources from this video into your life or healthcare routine, please first consult with a medical professional. With this video, I want to give you hope that there is a better path forward for you. So for so many of us on the spectrum, I truly believe that having the right vocabulary and understanding of our experiences can lead to transformation. So many of us just live our lives without the understanding of what is actually happening. It feels like we're in a very reactive place, not a proactive place of being able to create our lives, but just responding to things that are happening. And so I think by talking about topics like this and understanding how and why they affect the autistic community, we can become more empowered and have more of a say in how our lives look from this point on. I know it's very normal and common for people who deal with eating disorders to also feel a lot of shame and a lot of guilt for dealing with these things. I want to let you know that there is absolutely nothing wrong with you. There's a reason that you have the patterns that you have, and my goal today is to help you better understand those patterns and equip you with tools and resources that can help you make some really significant changes in your life. The number one change always being more self-compassion, self-care, self-understanding. That's where it all starts. So in this video, we're going to be talking about the prevalence of eating disorders in the autistic community. I think the numbers are going to shock you. We're also going to be talking about why there might be a connection between the two. We're going to explore 4 different types of eating disorders, symptoms related to each of those disorders. And then at the end, we're going to talk about some accommodations that can be made for autistic individuals to better support themselves and have a healthier path forward. And last thing before we jump right into the content here today, as I said, I'm Taylor with Mom on the Spectrum. I'm a late diagnosed mom. I received my professional autism diagnosis at the age of 31, which was almost 3 years ago now. And since then, I have been studying, learning. I get to interact with the autistic community daily, and I create resources to better support our lives. If that sounds like something that might be helpful to you or a loved one in your life, please subscribe to the channel. Okay. The first information I'm sharing today, this is from one of my favorite autism websites called Embrace Autism. Please know that any resources that I share in this video, I will make sure to list in the description below. You can also navigate the video by clicking on different timestamps to jump to different sections. Okay, so from the Embrace Autism website, 70% of autistics have atypical eating behaviors, while up to 30% of us have an eating disorder. This is over 3 times the prevalence rate of the general population, which is 9%. We are also disproportionately represented in treatment centers, with up to 35% of people who are tested for an eating disorder being autistic. And then this was shocking to me. We are so disproportionately affected that clinicians are advised to screen for autism when someone presents with an eating disorder. Let that sink in for a second. Eating disorders in the autistic community are so prevalent and so common that when someone walks in with an eating disorder, it is being recommended to clinicians that you also screen for autism. Wow. Also, in my research for this video, I came across a hyphenated word to describe this connection: autism anorexia. Okay, so that's how it's being discussed in clinical circles because of the prevalence of this connection. Why are these two things so heavily connected? Well, if you've been around on the channel for a while, you've probably heard of something called alexithymia. Alexithymia is the inability to put words to emotions. So we might be experiencing something really intense, but not be able to talk about what is happening. There's also a term you may have heard of called interoception. Interoception is the ability to identify our internal cues from our body. So whenever we feel hungry, tired, thirsty, we need to go to the bathroom, all of those things require interoception. And both interoception and alexithymia are things that the autistic community can struggle with. We also have sensory aversions. So that's going to play a role in a lot of what we talk about as we explore the 4 different types of eating disorders we're talking about today. Sensory aversions can make it really difficult to find things that we actually want to eat. And then lastly, we have a lot of social differences. So it shouldn't come as a shock that eating is primarily done in a social way for many of us. And so that can add a lot of complications for people who are autistic, because not only do we have to deal with sensory aversions of eating foods that might not feel good to us, we have to do it oftentimes in a social setting where we're trying to constantly figure out different cues, what's expected of us, and we have this heightened, this elevated sense of our nervous system kind of being on high alert and trying to figure out what's going on as we're eating. So the combination of these 4 heavy hitters, alexithymia, interoception, sensory aversions, and social differences, those all play a significant role in our ability to nourish ourselves. If we don't understand that we're hungry, that's going to create a lot of confusion for how to actually support ourselves and get ourselves enough calories. So that being said, let's jump into different types of eating disorders. Again, please check in with yourself during the video. If you start to feel upset or uncomfortable, please pause, go do something to regulate like stim. You can watch one of my recent videos over stimming, go outside, cuddle with a pet, and then come back to this video later. The first one that we're going to talk about today is Anorexia-nervosa. So anorexia may cause the following symptoms: missing meals or eating too little, limiting consumption of high-calorie foods, lying about what you ate, or excessive exercise. Research shows that anorexia and autism is caused by having a high level of anxiety, a rigid, rule-driven approach to eating and exercising, food-related sensory problems, and difficulties sensing hunger. A second eating disorder that this is new to me, and it's very interesting because I think that yes, there is a huge correlation here with the autistic community, is avoidant restrictive food intake disorder. You might see it listed as ARFID, ARFID. This information is from the National Alliance for Eating Disorders. Anxiety disorders are also commonly co-occurring with ARFID. ARFID is also formally known as selective eating disorder. People with this disorder do not get enough calories because they either, 1, refuse to eat, or they have a tendency to avoid certain types of foods. This disorder is characterized by an overall lack of interest in eating. You may avoid food based on certain sensory preferences. So if something like the texture is weird, it looks weird, it smells weird, you might have just really specific things that you can eat. And if it veers out of that category, it's just a no-go. You may have difficulty swallowing or chewing your food. You might want to eat in social isolation away from other people. And then you also might have a tendency to vomit or gag after exposure to certain foods. ARFID is not typically linked to body image issues the way that Anorexia-nervosa is. This one really just tends to be more about not wanting to eat, usually due to sensory aversions. There's an amazing resource that I'm going to share that can help you with this eating disorder in particular at the end of this video. Next, the third eating disorder we're talking about today is binge eating disorder. This is characterized by compulsive overeating. In order to be diagnosed with this, you have to have at least 1 binge per week. With binge eating disorder, you might eat even though you are not hungry at all. You might feel really full and overwhelmed and stuffed, but you're still going to eat. This eating disorder in particular is not followed up by purging, but afterwards you might feel pretty depressed and ashamed. That's a very common occurrence with this binge eating disorder. This can affect people of all different sizes, shapes, body types, and it can lead to obesity, diabetes, heart problems, lots of other health-related issues. The fourth eating disorder that we're going to talk about today is Bulimia Nervosa. And this eating disorder can cycle between dieting, binging, and purging. You might continue eating even if you don't feel like it, similar to binge eating disorder. In order to have this diagnosis, you have to binge at least once a week. And after binging, you usually compensate by fasting, purging, or over-exercising. Symptoms of bulimia nervosa can be a sore throat, swollen salivary glands in the cheeks, heartburn and acid reflux, dental decay, diarrhea, esophageal tears, and gastric rupture. And if I haven't already mentioned it, these eating disorders are very dangerous and they can even be fatal. So it's very important that we get the necessary knowledge and information about what is going on so that we can find support for ourselves or our loved ones. So a couple of interesting concerns I came across as I was researching this. One, eating disorders can actually overshadow an autism diagnosis and make it less likely that that will be discovered because you might be presenting with an obsessive interest in calories, food, exercising, or you might present with an extreme rigidity to routines. And then I also thought this was interesting. According to Embrace Autism, we mustn't diagnose autism in a person who is in a state of starvation, as this can mimic autistic traits. So what can we do to better understand and support either ourselves or a loved one who has an eating disorder? First of all, it's really important that you seek professional help. If you're interested in finding a therapist who understands neurodiversity, you can check out a website called ndtherapist.com for neurodivergenttherapist.com, and I'll put that link in the description. Also, I came across a very specific resource for this. It's an Instagram account. It's Livia Sarah. She's an autism and eating disorder recovery coach. Okay, so y'all hit her up. She has a lot of great content. Other accommodations that can be made: emotional education. So it's very important, especially since we deal with alexithymia, to better understand emotions. And there's something that I really like to look at and consult that my psychologist showed me. It's a body imaging, like thermal imaging map of how emotions show up in our body. So it's like happiness looks like this, and shame looks like this, and it kind of shows the parts of our bodies that might feel warm or cold. So I will put that link in the description. But there's also a lot of other ways to develop emotionally. So looking into emotional education can be very helpful for managing eating disorders and being on the spectrum. Along with that is anxiety management, therapy, all of the things that we already know to do for anxiety management, meditation, making sure we're spending a lot of time out in nature, spending time with pets, animals, plants. Increasing body awareness. This is huge, and it also helps with emotional regulation. So things like yoga, mindfulness, mindful breathing, just becoming aware of where there's stress and tension in our body, becoming mindful of that, and just breathing into that, learning how we can use our body's cues to influence our actions. Also, the development of interpersonal skills is very helpful. You can actually work with an occupational therapist as an adult. I know for many of us that might seem like something that's only for autistic kids, but there are occupational therapists who work with adults, and I have a resource I can put in the description for you. Occupational therapists can help you with managing routines, with learning how to interact with other people. There's so many great things that OTs can help you with, and I highly suggest checking that out. Also, staff training in autism is super important. If you work at a company, it's important that the higher-ups and the company in general is aware of how autism presents, how neurodiversity affects the company. Trainings are essential to better understanding how to support each other. Accommodating sensory issues. Anything you can do to help manage sensory aversion, to make sure that you're accommodating your own sensory needs and becoming more aware of your sensory profile, things that feel good, things that feel upsetting. The more aware you become of those patterns for yourself, the better you can support yourself. And lastly, I personally believe that there's a strong correlation in eating disorders and autistic meltdowns because there's so much sensory overwhelm involved in eating disorders. I think it can often push us into a meltdown, that they're probably both really wrapped up in each other. So if you're interested in learning more about meltdown management, you can check out my meltdown survival guide. I will put the link in the description. And that is, I think, like a 14-page guide that's going to go into more detail. What are autistic meltdowns? What are some warning signs? What are some ways that we can manage autistic meltdowns, recover from them, better understand them? There's some reflection questions at the end to better understand your patterns. And if that sounds interesting to you, I'd love for you to check it out. I will put all of the resources that I mentioned in the description, so just scroll down and look for that. If this video was helpful to you, please give it a thumbs up. If you watch this video all the way through, please take a second. Actually, I know you're just going to watch the next thing that pops up, so let's just take a second here together. We're going to take 3 deep breaths, and we're just going to become mindful of what our body is doing right now, okay? So we won't make it weird. Just big inhale. Exhale through your mouth. 2 more times. Biggest breath you've taken in all day. Sigh it out. listen to the stillness in the room for just a second. Pay attention to any ways that your body's speaking to you right now. If you feel jittery, if you feel overwhelmed, stressed, there are things that you can do to take care of that right now. Stimming is great. Large physical stims, jump up and down, do jumping jacks, run down the street. Anything that you normally do that helps you self-regulate, please make sure that you take time to do that after watching this video. If you're comfortable sharing, let me hear from you in the comments how this resonates with you. Don't share anything that's too personal to put on the internet, but I would love to hear if this was helpful to you and what other topics you'd like to see covered in the future. Thanks so much for watching. Please remember to subscribe if you haven't already, and I will see you in the next video. Be kind to yourself. You're amazing. Bye.